I'm Dwayne Brown. Tonight on KPBS Evening Edition, evidence of a policy change at immigration detention centers, how a bed quota may be a factor.
San Diego County now offers free mental health first aid classes. I'm Peggy Pico with who it's for and how it works. But first, should police watch video from their body cams before they file a report? Why a proposed bill says no, and what the current regulations are in San Diego.
A medical system under fire tonight for failing to treat veterans in a timely manner. The changes made in La Jolla that's offering relief to patients. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. Buckle up, some twists and turns in store for a historic park by the water. And we're not talking about that wooden roller coaster. San Diego City Council today voted to amend its lease with the operator of Belmont Park in Mission Beach. KPBS Metro reporter Taryn Minto joins us from the newsroom with more. Taryn, fill us in. What changes were made to the lease at Belmont Park?
The amended agreement would raise the minimum annual rent by about $250,000 up to about $1.1 million, and that would increase every year. The new lease also requires the operator, Pacifica Enterprises, to make millions in improvements to some of the historic sites. There's such as the Giant Dipper roller coaster and the plunge pool. It also gives Pacifica an option to extend the lease through 2069 before it was due to expire in 2038.
And of course, this issue has been a bit controversial. What's the concern about these changes?
Right. The amended lease came before council members in September. Some council members questioned if the city was getting enough money in rent from such a popular attraction. And the new lease does require Pacifica to invest millions more in upgrades to the property. But recently, there's been concerns over potential legal action. Shortly before today's meeting, environmental lawyer Corey Briggs claimed extending the lease would violate rules on how the city-owned Belmont Park can be used. But if there is a lawsuit, it seemed that Pacifica would help cover the costs.
And plenty of community members attended the meeting today to share their thoughts. What were they saying?
Well, a few speakers echoed some of the council members' previous concerns, but they were overshadowed by what looked like an organized group of community members and business owners. They say the upgrades that Pacifica has already made, making the area cleaner and safer.
KPBS reporter Taryn Minto. San Diego County officials found this year's first case of West Nile virus. A dead hawk in Spring Valley tested positive for the mosquito-borne disease. Last year, 11 people in the county were diagnosed with the virus, and 2 of those cases were fatal. It's exceeding expectations. Demand is up for a new California driver's license that can be used by people who are in the country illegally. The DMV says California received nearly 500,000 applications in the first 3 months since a new law took effect. The agency thought it would have taken them longer to process. So far, more than 200,000 licenses have been granted. DMV expects to approve 250,000 more. New government figures show the number of immigrants being held in U.S. detention centers is actually down to its lowest level in nearly a decade. The decrease may be signaling a change in a controversial federal law known as the bed quota. iNewsSource reporter Joanne Farian joined us earlier to explain. Joanne, first tell us who immigration officials or ICE can hold in detention.
Well, they can detain any non-American citizen who's in the country illegally or if they've committed a crime. Detention is a holding place while the courts decide whether to deport them. For nearly a decade, the federal government has been increasing the number of detention beds across the country from less than 20,000 a decade ago to 34,000 in recent years. The most controversial part of all of this has been something called the bed mandate, a line in a federal law that says ICE must maintain 34,000 detention beds. In the past, immigration officials and some members of Congress have interpreted this to mean ICE must fill all 34,000 beds with people. In other words, fill a quota. In recent years, the detainee population has hovered around 33,000. That's until now. Now let's take a look at the numbers. If we go back 10 years, there were less than 20,000 immigrants being held in detention. It steadily increased from then on, last year to more than 33,000, nearly meeting that quota. But look what's happening now. In the first part of this fiscal year, just over 26,000, the lowest it's been in nearly a decade.
Obviously, the question here, why the decrease?
Well, a number of reasons. One being the way the 34,000 bed mandate is now being interpreted. Secretary of the Department of Homeland Security, Jay Johnson, who took office little more than a year ago, told a budget committee he interpreted the mandate to mean ICE must have 34,000 beds available, that in fact they didn't have to fill them with people. And that's a change to previous statements by high-ranking immigration officials. And there's also been a change in enforcement policies as a result of President Barack Obama's executive action. ICE officials are now being directed to focus on apprehending criminals, people with gang ties or linked to trafficking crimes, rather than people who are here illegally but otherwise haven't broken the law.
Hi, News Source reporter Joanne Farian. It's estimated the revolving door of chronic alcoholism costs county taxpayers $20 million a year, but a program developed by San Diego's Mental Health Services and the police department is gaining national attention for helping some of the hardest people to treat, get off the streets, and sober.
I've lived under the bridge, in a cemetery.
Robin Mock has also lived on the streets from downtown San Diego to Hillcrest. She's now a former member of one of the city's most challenging and underserved populations, people who are chronically homeless for 10 to 15 years and addicted to alcohol. Were you acting out?
No, I wasn't acting out. I was just drunk in public, passing out. I was in the hospital many, many times, and just out of control.
From emergency room visits and paramedic transports to hospital stays, the cost of public intoxication in San Diego is enormous. That's why the SIP program was developed 15 years ago to help close that revolving door.
I get more people out of jail than I put in jail, so it's a good thing. I mean, that's what we want to do.
The program offers people who've been picked up numerous times for public drunkenness treatment in lieu of custody. It's also reduced the drag on emergency medical services by 54%, something other big cities like San Francisco, New Orleans, and Las Vegas have been seeking help.
Assist them with developing a treatment program that's really focused on chronic inebriates, and then beyond that, how the arrest works, how the criminal justice system works, and building that collaborations.
SIP now has its first and only temporary housing space, where 32 clients are learning to deal and heal from years of neglect and homelessness.
I feel tremendously better, 100% better. Was it easy? No. Was it worth it? Yes. I plan on continuing my sobriety done through the steps in the program of AA.
The clients in the program say they relate well to each other and they all attend treatment programs to help stay on track. Should a police officer wearing a body camera be allowed to view the footage before writing their report? A San Diego lawmaker says no. Peggy Pico has an update on body cam regulations.
Right now, officers in 3 police departments in San Diego County wear body cameras, and at least 4 more local police departments say they'll be adding them soon. Meanwhile, San Diego Assemblywoman Shirley Weber introduced AB 66, a bill that would regulate how police use body cameras. Joining me with current standards and concerns are San Diego Police Chief Shelley Zimmerman and Kellen Rusignello, ACLU attorney for San Diego and Imperial counties. And Chief Zimmerman, currently, there are 600 officers at the San Diego Police Department who wear body cameras. Do the cameras record automatically, or are they manually turned on and off?
Well, what happens is that they're in a buffering mode, so they're always on, but recording over itself every 30 seconds. That would be video only. And then once the officer hits the record button, it loops back those first 30 seconds and then continues on with video and audio.
And what's the guidelines as to when they hit that record button?
Our policy is that it's for enforcement contacts.
Okay, so if somebody's pulled over, or
exactly.
If they're going to...
if it's an arrest, a detention, a field investigation, a vehicle stop, then the camera will be on.
Okay, and Assemblywoman Weber, her bill seeks to regulate when and who can view police video. What are the policies right now at the San Diego Police Department on that?
You know, and first, we're the largest city in the United States that have deployed 600 body cameras. So we have more body cameras as the 8th largest city than any of the other cities actually above us combined. And our policy is that, and it's also not just our policy, but it's also the Department of Justice policy for best practice, is that the officers do have an ability to view the video before writing the report. And that's to make sure that we write the most accurate report.
Can officers edit the video?
They cannot edit the video.
Okay.
They cannot.
Kellen, what are your concerns with when and who views this footage captured by police cameras?
Sure. The concerns about an officer being able to review the video of an incident that they're involved in, maybe a critical incident like an officer-involved shooting, is we want to make sure that we're getting accurate accounts of what happened, that it's being that we're holding the people accountable for their actions, and that it's being portrayed as fair. So accuracy. A person that reviews their video likely will latch onto things that they see in the video and forget things that they would have remembered if they had wrote the report beforehand. And we want to make sure that we include that evidence as part of it as well. We also want to make sure that this is, we're being holding people accountable. So if somebody watches a video before they write their statement, they have the opportunity to change their story to match the video. And that's something that we want to avoid.
You're talking police officers here.
Exactly. So police officer, they might say, if they know that they're not going to have the chance to avoid it, or not have the chance to watch the video before, they have the incentive to write down everything exactly as they remember it as it happened. Otherwise, they would be able to watch the video and kind of match their facts.
And what about for the people in the video, the defendants? Why would it be an issue there?
Well, this is an issue of fairness. So law enforcement for a long time has used the technique where they would interview a person and get their statement prior to showing them any other evidence, whether that's audio or video. And that's just to make sure that you can corroborate their story against existing evidence. This would allow the officer special treatment and would portray unfairness for the general public to not be able to view the video, whereas police officers
let me ask the chief about that. So if you're arrested, can you see your video?
You know, first of all, I disagree with Kellen here, is that it's critically important that our officers have the ability to view the video before that they write their reports. You know, we've embraced this technology, and it's all about doing our jobs better. Early in my career, I've been on them more than 30 years, we didn't necessarily have a tape recorder, and now, you know, you can have a tape recorder where you can get the most accurate statement of an individual. And so this technology of body-worn cameras just assists us to do our job better. And we're seeking the truth, and we want to have the most accurate report, which is critically important for public safety.
And just very briefly, why can't the defendant, let's say, who's arrested, why can't they see their video before they write their statement?
You know, the individual that's arrested, they don't have to make a statement. They're given their Miranda rights, and they're under no obligation to give a statement. But the officer does have to write their police report.
Okay. And let me ask you this, Kellen. What regulations or policy, in light of this bill on the table here, would you like to see change as far as how viewing or how this footage is used?
Well, we support AB 66 and Dr. Weber's bill. We would like to see the policy include that an officer cannot review their video of incidents where they're involved in a critical incident like a shooting or something like that. They should be able to review after they submit their initial written report, and maybe file an amended report after they see the video.
I see. And we may have one quick answer for you on this one. How are you evaluating the results of this so far?
You know, we did our first analysis on it, and it's been very favorable. Our complaints are down. Our allegations are down, contained within those complaints, and our use of force is also down. And so very favorable early analysis of this, and continue with this program.
All right, Police Chief Shelley Zimmerman and Kellen Rusaniello, thank you so much.
Thank you.
They're demanding an end to domestic violence. 3 sports stars from San Diego are speaking out in a new video.
And you think it's not the time.
But domestic violence is violence.
It's against the law. Now.
That's BMX champ Elise Post and pro skater Tony Hawk. Chargers linebacker Melvin Ingram joins them in this message. Officers responded to 17,000 domestic violence incidents in 2013. Deputies say kids were present in 37% of those cases. Rolling Stone calls it an anatomy of a journalistic failure, responding to an independent review by the Columbia Journalism School investigating a now discredited magazine article. The November article covered a University of Virginia student who said she was gang raped at a frat house. Police say there is no evidence the attack took place. Today's report from the J School says the failure of the magazine article was avoidable. The report goes on to say the magazine's shortcomings encompassed all levels, from reporting to editing to fact-checking.
Look, we're not the DA's office here. We're not a special prosecutor. We did not find, and as we say in the report, we didn't find evidence of the kind of dishonesty, invention of facts, lying to colleagues, plagiarism, that in our experience and probably yours, you would regard as grounds for automatic firing or severe sanctions.
The magazine has pledged to review its practices. The fraternity at the center of the story says it was defamatory and reckless. Phi Kappa Psi says it will pursue legal actions against Rolling Stone. The fraternity claims its members were ostracized after the article was viewed by millions online. On to the health desk. A new Associated Press report shows patient wait times have been greatly reduced at the VA Medical Center in La Jolla. From our North County Bureau, KPBS health reporter Kenny Goldberg says the VA system has been under fire nationwide.
Last July, most new patients at the VA Medical Center in La Jolla had to wait an average of 44 days to see a doctor. The new report shows there's been a big improvement. On average, between last September and this January, less than 3% of patients had to wait a month to be seen. VA officials say they've hired more doctors, opened a new clinic in Sorrento Valley, and now offer evening and weekend appointments. Officials say as a result, access to primary care is good. But they admit that's not the case in some specialty areas, including physical therapy. Last year, the local VA treated nearly 79,000 patients. Kenny Goldberg, KPBS News.
The county is now offering the public free classes for mental health first aid. Peggy Pico explains how you can get involved.
Mental health first aid classes are similar to standard first aid courses, but these classes help an average citizen learn how to safely intervene during a mental health issue or crisis. Mental Health America of San Diego County is offering classes for free. Executive Director Daphne Watson and Outreach Coordinator Kurt Cunningham join me with the details here. And Daphne, it's usually obvious when somebody needs physical first aid. They might be bleeding or clutching their chest or something like that. How do you know when it's time to use mental health first aid?
Well, Peggy, most times individuals give you a sign. Either they look different, they talk different, their expressions, their behavior is a little bit different than they normally have. Often, many times we ignore that and we don't intervene like we should. But mental health first aid teaches you exactly what to say, what tools to use, what skill you can have to really engage a person and find out if they're having a mental health crisis.
So give us a few examples of how the course teaches you to do that, to intervene, what to say.
Well, they use a technique called ALGE within the class, and it's an 8-hour class, and each of those acronyms address a different issue, like acknowledging the individual, making sure that we talk about suicide or inform or get involved in understanding what that means, non-judgmental education and training. We really use these techniques to really help an individual understand what they need to do.
So addressing it, because that's interesting, because Kurt, before working with Mental Health of America, you experienced struggles in dealing with family and friends with mental health issues, and acknowledging it, you said, was important. Why do you think these courses are needed?
It's very important. The average person, just everyday average person, can put these tools into use, and they're very simple. Biggest thing is just being compassionate, just asking the question, are you doing okay? You know, things might not be so great for you. How are you doing? And it's really just simple, that simple to start with.
I think sometimes people are afraid, Daphne, that if somebody looks like they might be depressed or even suicidal, that if you address it, you might push them further.
That is a belief that people have, but it really is just the opposite of that. Individuals really want you to engage them. And if you do, the outcomes usually are pretty positive. And so we really encouraging individuals not to shy away from a person who expresses a mental health challenge, or they want to hurt themselves or use those terminology. We really want to engage that individual.
Interesting. And Kurt, how many people living in San Diego County are believed to have mental health issues?
Well, 1 in 4. 1 in 4 people have a mental health issue.
Living here in the county. That sounds high. So we're talking a big spectrum?
It is high, although we don't know because people don't talk about it. People don't talk about it. They're afraid to bring it up. They don't address it.
And the statistics nationally show 1 in every 4 individuals. So it's not just in San Diego. That experience is national. Now, there's a continuum. There's things like mild depression and mild issues, but then there's and more severe like schizophrenia and other conditions like that.
I see. When should either the person who's trying to intervene or help or the person themselves who has a mental health issue, when should you seek professional help? And maybe you're trying to do the mental health first aid. Is there a point where you say, look, I need to get on the phone and get some help here?
Well, the class teaches you that you shouldn't leave a person without getting them help, so that you want to connect them to some professional help right from the beginning, because it's important to have a professional assess. Just like if you think a person is having a heart attack, you don't assume that, well, I'm not sure that how this should go or if this is severe enough. You really need a professional to make that assessment.
In Kurt, I understand a lot of people have already signed up for these courses. How do you sign up, and how long do you go through the classes?
It's an 8-hour course. We have them all over San Diego County, and as well as our offices in North Park. You would call 619-543-0412, or you could email our program coordinator, Raquel Morrison.
Sure. And we have that information on our website as well, kpbs.org. Daphne, we'll end on this. How much mental health training do first responders and police, let's say, in San Diego have in dealing with mental health crises?
A lot of individuals don't have enough understanding of training. And we are going to actually train law enforcement in mental health first aid. But we want every average, ordinary lay person to get this training, because those are the first contactors of a person with a mental health crisis. So the more we get everybody trained, it would be nice to have all San Diegans trained so that we really can improve the conditions and the outcomes for individuals with mental health issues.
Right. Well, like I said, a lot more information on our website, kpbs.org. Daphne Watson and Kurt Cunningham, thank you so much.
Thank you.
Thank you.
I appreciate it, Peggy.
I'm Hari Srinivasan. On the next News Hour, a new report on what went wrong with Rolling Stone's reporting on a UVA rape case. That's Monday on the PBS News Hour.
Easter eggs and kids took over the White House South Lawn today. 35,000 people showed up for the annual Easter egg roll, a tradition dating back to 1878. This year's theme celebrated the First Lady's campaign to help kids eat healthy and exercise. Today, President Obama shared one of his favorite books with the kids, Where the Wild Things Are.
Hold on! Hold on! You guys are wild things! You're not supposed to be scared of bees!
A bee buzzed by, interrupting the reading. You could hear some children squealing. President Obama promised them the bee would fly by without stinging them. The White House staff left their fly swatters at home because saving honeybees is priority for this administration. Organizers handed out seeds to kids to encourage the planting of bee-friendly habitats. A celebration of all things geeky will change venues next year. Fans of WonderCon, the sister convention to Comic-Con, found out over the weekend. KPBS arts reporter Beth Accomando was there in Anaheim. She takes a look at what may be the next tug of war over pop culture conventions.
As WonderCon drew to a close on Sunday, attendees were abuzz with news about the convention leaving Anaheim. The change of venues was officially confirmed this morning by David Glanzer, spokesperson for Comic-Con International.
WonderCon 2016 will be in Los Angeles. We didn't have the space requirements in Anaheim, so we looked around and Los Angeles was able to accommodate us.
WonderCon has a history of moving around. It began in Oakland in 1987, then moved to San Francisco in 2003, before settling in at the Anaheim Convention Center in 2012.
Do you like WonderCon?
WonderCon works on a year-to-year basis in terms of contracts. Comic-Con we try to do farther out, although I will say we're coming close to the wire on Comic-Con as well, because we're signed in San Diego to 2016, but not after that. 2016 is going to certainly be a challenge. Hopefully we can decide what's happening with San Diego prior to that, and hopefully we can figure out early on what will happen with WonderCon as well. We've been grateful to Los Angeles for treating us very nicely in terms of allowing us the space.
In the hopes of continuing a relationship with Comic-Con International, the LA Convention Center seems to be seizing the opportunity to show what they can offer to these pop culture conventions. Beth Accomando, KPBS News.
LA's Mayor Eric Garcetti welcomed the change. This may be a sign that LA has its eyes on the wildly successful Comic-Con, which has been held right here in San Diego for more than 4 decades. San Diego is under a wind advisory until Wednesday. We are also looking at a slight chance of some rain. You may see some showers by the beaches tomorrow, temperatures mostly in the 60s. The inland valleys may see 60s and 70s over the next few days. There is that wind advisory in the mountain areas with a mix of clouds and sun. Temperatures much cooler, 40s to 60 by Thursday. And 70s and 80s expected in the desert. Here's a look at what we're working on for tomorrow in the KPBS newsroom on Midday Edition. It's been called the most important scientific advance of the 20th century. Reporter Jonathan Egg talks about his new book, The Birth of the Pill. That's tomorrow at noon on KPBS Radio. Of course, you can find tonight's stories on our website, kpbs.org/evening edition. Thanks for joining us. You have a great night.